So it depends on where the scar is, but usually there are treatments that we could do in our clinic, and is a bit of like going to the dentist most of the time. If there are bigger scars, we will need to plan to go to the theater, and the patients need to be informed about anesthesia as well. But the problem that we got in practice are usually solved by local anesthesia, walk-in surgery. So patients come in the clinic, we arrange these minor procedures. That means some local anesthesia, some sterile rooms, but patients can go home immediately after the procedure. We mark the area, we discuss how much to take out. Sometimes some scar they need multiple steps, sometimes the scar are small, and so we could do it everything in one go. We got a nurse that follow patients to book them to have the surgery done. We do the procedures, and patients that get the post-operative instruction immediately after. They avoid to sweat and exercise for a period of time after the procedure. Obviously, usually the scar they didn't come up well. They had some problem after surgery, or they had some problem, after traumas, because many of the scar, the plastic surgeon revise, they don't come for our procedures, but they come for accidents. They come for other specialty scars. They come for infection after the surgery that the patient had it. Sometimes in emergency sections or emergency appendicitis, emergencies, abdominal surgeries. They often leave bad scarring because the wound is contaminated, present, bacteria. It's not the same as a microsurgeon suture and a clean margin and a new scar. So that's why plastic surgeons, sometimes we excise the scar to redo things, and our margin is more clean compared to a trauma wound. And so this obviously influences the result and the outcome of the scar. We study years to understand the whole plastic surgeon skills. We do flaps, that means we move a piece here and there, we cover the holes. I think we are a good one to try to create a collage. So any sort of scar can be excised and reconstructed. So probably reconstructive surgery techniques, they help a surgeon to give and release good scar revisions. It depends on where the scar is, because if it's in the face, usually patients, they recover in around 2 weeks' time. If the scar is on the back, it takes around 3 weeks, 4 weeks to recover. If it's on a lower limb, it could take up to a month or 6 weeks to recover. It depends. Yes, nowadays there are the technology. There are some technology that can help, the laser, some infrared, or some injectables. Sometimes we use injectables to improve the texture of the scar. Because when there is a scar, the skin appear in a different way. And so the appearance of a scar can be improved with fillers as well. Sometimes we use Botox to symmetrize the face, scar in a lip. Sometimes we use a filler in the lip. Depends. We got many things nowadays to adjust the scar. That's why we don't see scar. It depends on the insurance policies the patient has it, and it depends on the reason why patient has the scar. If it was a cosmetic procedure, so probably insurance will not cover for it. But if it's a trauma or if it's an infection from another sort of procedure, the insurance cover costs. But we are happy to follow patients and drive them into the insurance word is difficult for somebody that doesn't know the system, while we are used to see patients, and so my PA can help them. And the scar revision, unfortunately, is always a wound, and a wound can always have a healing problem. Most of the healing problem are due to infection. So good hygiene is essential after surgery, and follow instruction and follow advice is difficult. Don't sweat is something difficult to don't do it, but sometimes patients they don't feel a pain, and so they don't look after themselves well. While when we do this scar revision, we want to be successful. We want the surgery to be worth, and that's why probably we hold the patients to restart their own life longer than we should to prevent unhappiness or recurrence and bed scar again.